Let's talk about external valve collapse. What does that mean? That means when you breathe in, usually this right here is collapsing in. When you breathe in, that's called dynamic collapse when it goes in. Static collapse, which means that just when you generally breathe, there's an anatomic obstruction inside your nose, which is there even if you're not doing this heavy, intense breathing. So you could have static or dynamic or both collapse. In general, what is the reason from that? Usually an iatrogenic cause, which means over-resection of the cartilage in the tip of the nose. And how do we fix that? We have to put in pieces of cartilage to support this part of the nose, either called alar batten grafts or lateral curl strut grafts. Some patients just have very weak cartilage and it collapses when they breathe. If it's a previous surgery, we're going to have to use rib. Sometimes there's another device that absorbs called Latera, which is a very quick procedure we can do either in the office setting or in the operating room. It's about the size right up here, and it absorbs in about 9 months, but it goes inside the nose and adds more of a tethering device to prevent the dynamic collapse. I've done a good amount of these, and patients feel that it improves their breathing.